Hi guys, I'm Dr. Faruqi. I'm one of the lung and throat cancer physicians over at our Ironwood Chandler office. And today I want to talk to you guys a little bit about the flu season and how it impacts our cancer patients. So the flu season can be dangerous for everybody, but it poses an especially large threat for our cancer population. In 2024 alone, and 2025, the CDC has estimated about 24 million cases of flu being diagnosed. In Arizona, there's been already about 47,000 cases reported in the last year. This is up about 25% compared to the year before, and up about 120% compared to a standard year of the flu. So this year especially, we're seeing the effects, since we wanted to use this video to raise some awareness and educate you guys on how to be careful and what to look out for. So the first thing to talk about is, well, why are cancer patients more at risk than anybody else? So it may seem fairly obvious, but basically when a patient is on either chemotherapy or even radiation therapy, their immune system is impaired. When your immune system is impaired, any small infection that would normally be very easy for the body to handle and recover from can be amplified. So a simple viral infection can sometimes become life-threatening. It can cause things like respiratory failure, severe fevers, that can lead to dehydration. So that's why cancer patients and patients who are especially on treatment sometimes suffer the most. I specifically focus on lung cancer patients, and I've seen a lot of my own patients have poor outcomes with flu and other viruses. And the other population that you want to be wary of is any blood cancer patients, because a lot of times blood cancer patients, because of the disease itself or the treatments they're on, their immune system is especially affected. So the second thing to talk about is, how can we prevent flu and how can we remain safe? So a lot of these things are, items that a lot of you are already practicing, but it's always good to get a reminder. The first thing would be is to practice very good hygiene. So that means washing your hands. If you're touching public objects, doorknobs, things like that, make sure you're especially careful in washing your hands and not touching your face or your mouth. That's a very common way that the virus can transmit. The other thing would be to avoid anybody who is sick around you. So if there's a family member, make sure you're keeping distance. If you have to rely on masks, whether it be to, share a space with a family member who's sick, or if you want to go to an event and you feel like you're going to be in a large crowd, then it may be worth using a mask. It may be worthwhile to avoid large crowds in general if you are a cancer patient who has high risk, but we understand that that's not always possible. The last part of prevention is obviously the vaccine. So there is an influenza vaccine that is redone and comes out every year. We are kind of getting later into the flu season, but it's always a good reminder to talk to your primary care doctor or your oncologist about whether the vaccine is right for you or when the timing should be. The thing to remember is that depending on where you are in your treatment cycle, your doctor may recommend a certain date or time to get the vaccine. And also there are two types of vaccines. There's a live and there's an inactivated vaccine. Those are also worth discussing with your oncologist on which one was right for you. So the third thing to talk about would be, you can do all the prevention you want, but there's still no guarantee that you will not get flu. So what would happen if a cancer patient gets diagnosed with flu, or if you're worried about flu? So the first thing would be to obviously notify your provider, whether it be your primary care doctor or your oncologist, and see if you can get a flu test done. If you are flu positive, sometimes if it's been within a day or two of your diagnosis, you can be prescribed a medicine called Tamiflu, which has been shown to decrease the time of symptoms and has also been shown to show good outcomes for our patients. Besides that, a lot of it will be hydration, getting plenty of rest, and making sure that you are eating and drinking, your energy levels are okay enough to perform your day-to-day activities, and that you're managing on your own. Some other severe side effects of flu that sometimes get overlooked are if you have very high fevers for a prolonged period of time, if you are having vomiting. Those two things can cause severe dehydration, or if you feel like your breathing is getting very challenging or your oxygen levels are getting too low. Some patients of ours will get a pulse oximeter. It's a little device that you put on your finger, and you can actually measure your heart rate and your oxygen level using that. And we've actually had patients call us saying, my oxygen levels are this, my heart rate is this, what do I do? So that's another tool you can use if you're really worried. If you ever feel like things are getting worse, your breathing is impaired, you're not able to keep up with your oral intake, you're not drinking enough liquids, eating enough during your meals, and you're worried you're getting dehydrated, it's never a bad idea to obviously notify your provider, but also to go to the emergency room if you're worried. So with all that said, flu season can be very scary, but as long as you take the right precautions, you stay safe, you stay hygienic, and you notify your doctors about what's going on, hopefully you'll get through it like many of us have. Thank you so much.